Welcome to Family Health by Mini First Aid. Mini First Aid are the UK's leading family first aid provider, and we are delighted to bring our latest podcast series to you, giving you all the information that you need around family health subjects. Thanks for joining. Series 3 of the Family Health podcast is sponsored by Savlon Scar Prevention Gel. Savlon Scar Prevention Gel speeds up healing, helps soothe pain, and reduces the likelihood of scarring when used on minor wounds, superficial burns, and grazes. And to be frank, with my 6 children in my house, cuts, scrapes, and grazes are plentiful. So my first aid kit, saviour, is Savlon Scar Prevention Gel. Hi folks, I'm Kate Ball. I'm the founder of Mini First Aid. Welcome to our podcast, Family Health by Mini First Aid. We are so pleased that you've taken the time to listen to our podcast. So whether you're in the car, perhaps you're cleaning the house, or you are relaxing with a cuppa or on your way to work, our Family Health podcast covers a huge range of topics that might affect one of your family members. And if you've ever got a family health concern and are thinking, I'll just Google that, then perhaps you need to have a listen to us instead. So, I am thrilled to introduce our guest this week, who are going to be talking about asthma, an issue I know our listeners will be really keen to hear more about. And I'm delighted to welcome 2 guests to our podcast today. Dr Greg Burch, who's the Joint CEO and Clinical Director at Tiny Medical Apps, the developers of a digital health passport designed to help deliver high-quality asthma care right across the UK. Greg is a very busy man because on top of that, he's also an A&E doctor. So we're very fortunate, Greg, to have you with us today. And I'm also delighted to welcome Ambreen, whose daughter has asthma, and she's going to share her story with us today. So Greg, Ambreen, thank you so much for joining us today.
Thank you, Kate. Really delighted to be here today. Thank you.
Brilliant. Greg, first of all, tell me a little bit about yourself. I've given you an introduction. It sounds like a formal CV. Tell us a little bit more so the listeners can get to know you a little bit better.
Sure, yeah. So my background, I work as an A&E doctor. I live on the South Coast. I work in hospitals in Brighton. Before moving here, I spent a long time working in East London. There's an asthma crisis in London, really, is one way of describing it. I worked and saw lots of young people coming into the hospital, with life-threatening asthma, which is really scary for everybody. It's obviously scary for the person who's struggling to breathe. It's terrible for the parents, but it's really scary for the doctors as well, because you feel, really quite panicked dealing with these situations and trying to do your best to keep people alive in these really scary moments. And that was partly what led to the development of the work that we do. And working in a sort of technology company, it's just a sort of different space. It's a different kind of challenge. And I find working constantly in A&E is too much for me, quite frankly. At the age I'm at, I'm just not able to manage it as some of the junior doctors do. So I like to have kind of 2 hats that I wear.
Great.
And that's kind of how I got into technology.
Brilliant. Ambreen, tell us a little bit about yourself.
Hi, so I am an academic by background, but first and foremost, I am a mother of 1. She's 12 years old and she's just started high school. We've both got asthma and allergies. So really, I'm here to share my lived experience of having, as a parent and also managing the conditions myself.
Great. Thank you, guys. And we look forward to hearing your story, Ambreen. Greg, just tell me a little bit more about the stats then. Do we know how many people in the UK are living with asthma? Does it split into age groups? What's the numbers?
Yeah, so Asthma and Lung UK estimate there's about 5 million people living with asthma or on asthma treatments in the UK. That includes some people who may be on treatments that don't have asthma, but then there's also people who have asthma that haven't been diagnosed. So it's probably about the right number. And of those 5 million, 1 million of them are children. So the way that works out is it's over 10% of the population are estimated to have asthma in total. And it's 1 in 5 households are living with someone with asthma at the moment in the UK.
That is some mind-blowing statistics.
It really is. And in fact, the UK has got really quite high prevalence. of asthma compared to other European countries, other comparable countries. We also have really high hospital admissions, and unfortunately we have one of the highest death rates for asthma in the world, actually, unfortunately.
Has it increased or decreased over the years?
It's not really changed much, to be honest. I mean, there was a study 10 years ago looking at the number of preventable deaths. We think that the rate hasn't really changed a lot, may have slightly increased. So what we've been doing over the years just hasn't been satisfactory, and there's been very few new asthma treatments until recently, with some new kind of biologic treatments which have been really helpful, but are only really given to those with the most severe asthma due to the cost of those, unfortunately.
I think it would be really helpful just to take us back to basics a little bit. We've all heard of asthma, right? I think most people could say they've heard of it. Most people know someone with it or have it potentially themselves. What actually is it? So what's going on in the body when somebody has asthma?
Yeah, so firstly, it's a lung condition.
Right.
It's a chronic condition, which means it's a long-term condition. It's not something that's kind of is fleeting. In asthma, the airways, the bigger tubes going into your lungs, they become inflamed and they tighten up, and people find it difficult to breathe. And the symptoms are shortness of breath, a wheezy sound in the chest, and cough are the most common symptoms. And in those airways, there's inflammation and a mucus builds up, as well as a kind of tightening of the airways. Mm-hmm. So there's a number of things going on there. But the main symptom really for people who have experienced asthma and an asthma attack is shortness of breath. But alongside those physical symptoms, there's the impact on you as a person, really. It's incredibly scary to have an asthma attack. So it leads to increased anxiety. There's also the effects of missing time from school. It can affect your mood. So it's more than just what it does physically to people as well, and obviously to the families as well.
Gosh, Ambreen, I'm going to bring you in here actually, because it'd be interesting to hear about your daughter's asthma. What were the warning signs for you? When did you first suspect that she had asthma?
For me, I think it came on the back of several back-to-back chest infections,
right.
Being given constant different antibiotics and different medications, steroids, to try and prevent coughs and wheeziness. That when it happened continuously over a period of time, I think there was a period of about 3 to 4 months where she just had back-to-back issues with breathing, and it kind of changed season over then as well. So she'd almost just got through her first winter, and that's really where things didn't really change. And I was like, well, there's something not right here. Mm-hmm. She had a combination of symptoms that kind of mimicked hay fever, symptoms that also mimicked, like food allergies after we'd started to unpick that a little bit for her. And then she had the wheeze on top of it, which then was accompanied by quite a severe cough. So it was just around her first birthday that we ended up in hospital with her, and she was given her inhaler, and it made the world of difference.
So she was really little then. So she really little. And did she get diagnosed at that point then, or was that just when you started your journey?
It's not usual for a child to get diagnosed at that age, but for her, she had to manage her condition we had to manage her condition with the inhalers for a couple of years before they really, explored and confirmed a diagnosis later on. Mm-hmm. But it was being able to actually, when we saw the signs, it was about managing it and staying on top of it once I knew what I was looking for. And because I'd had asthma myself, when you've got a child against your chest or over your shoulder, you can hear the chest. As a mother, you have that instinct. You know when there's something not quite right. So I can only describe really her sounding a little bit like a small cat. Like with that gentle sort of shallow breaths that she was trying to take at the time. And it's just, you kind of recognise that and then feel the rattle as well with the constant coughing. But then it ended up being, thankfully, having really proactive health visitors at the time that helped us get seen and get answers, really.
Yeah, that's really interesting. You talked about the first winter and times of the year, and Greg, can asthma be triggered by certain conditions then? So are there certain times of the year or certain things that can make the onset of asthma particularly worse?
Yeah, there's a whole host of things which can trigger asthma, and for different people will have different triggers. Changes in the weather, viruses are very common. Air pollution increasingly is a trigger for asthma. Household products, dust mites, the list goes on and on. Smoking, cleaning products.
Candles.
There's a long, yeah. The list is endless really, and vaping now as well will be triggering some younger people is asthma attacks as well. And it's really important really that people can try to understand what their triggers are. If it's a certain pollen, or it's cat fur, or it's certain cleaning products, in the hope that they can do their best really to try to avoid those triggers. Because it makes a massive difference. Obviously, you can take some of those triggers out and take those.
Ambreen, has your daughter got specific triggers? Have you got things over the years that you've noted have been particular triggers?
Yeah, it tends to be exercise-induced for my daughter, allergy-induced with food and hay fever.
Yeah.
But one of her worst periods, up until just this year actually, has always been that winter sort of change, where there's an extreme change in temperature, or in that constant fluctuation in weather of hot, cold, murky. You don't know what weather it is. Similar to April, really.
Right now.
Exactly. So it used to be that every winter she'd have to be on a course of steroids and antibiotics as well. But now being able to manage her condition better, we know what to do, and cold is no longer a trigger for her, because we're now using mechanisms like having a snood on and a scarf that she can just pull over her mouth and prevent that kind of thing impacting her too much.
So knowing those triggers. Greg, you touched on very briefly, and Ambreen did as well, about asthma and allergies. Do they go hand in hand? Is it one with the other?
Often, not always. Yeah.
Okay.
So asthma is really, it's a collection of things which cause asthma, which are increasingly being understood now. But asthma isn't really one disease, even though we think of it as the treatments kind of work as one. But a lot of people have what we've termed allergic asthma, which means their asthma is triggered by. But they both have a lot of commonality in that they involve inflammatory responses and how that works. So there's a huge overlap of people who have one or the other. Absolutely.
Now, if you're a parent and you suspect, or a carer, and you suspect that a child has asthma, what's the process for getting a diagnosis? How do you make sure your child gets the right treatment?
Yeah, so you need to be seeing your GP, and you need to be persistent really sometimes as well. I mean, we know sometimes how it is that not all GPs are trained in every condition to the same standard, and some GPs clearly know a lot more about asthma. They recognise it. But it's not easy to diagnose asthma either, and children particularly, when they're younger, a lot of them will have wheeze, and it's wheeze that doesn't actually turn into asthma. It's what we call a viral wheeze, which comes on when they've got an infection and a runny nose, and they get asthma symptoms. However, if there's asthma in the family, if you feel like your child's having symptoms like cough and being kept awake at night by coughing, if you feel like they're regularly getting wheeze, or that when they get exposed to certain things it makes their breathing worse, get to see the GP and really kind of lay it out. It can be helpful to keep a sort of diary of symptoms, even when your child is on treatment, actually, to see whether or not that treatment's working as well, and to be able to present that kind of to somebody, and to make sure that your voice is heard.
Yeah, great. So Ambreen, I want to talk to you more about your little girl, because just the thought of not being able to breathe or struggling breathing, it just is that anxious feeling, that panic. Did you have frightening experiences with your daughter? Has it been a scary time with her?
I think it's been kind of up and down, really.
Okay.
I think earlier in the journey it was more difficult, because your child can't really communicate everything that they're feeling or experiencing. I think as they grow and they learn to almost be empowered, really, to describe what they're feeling and to, understand that it's okay to talk about the symptoms and it's all okay that you're going to be fine as long as we can recognise it early and be able to treat you in the appropriate way.
Did you ever have any... Go on.
The scariest experience for us was when we were caught out of the blue.
Okay.
So she came down one night. It was actually in the middle of Ramadan for us. And at 3 a.m, she was like, couldn't get a word out. Literally, she had a severe wheeze, really tight chest. And I was like, well, you go into autopilot mode almost, don't you? And we tried, first line, we went for the inhaler. Tried it again, no change. I ended up ringing an ambulance, if I'm honest, because it wasn't making an impact. She was barely able to string a sentence together. But what triggered that event, yet to today, I do not know.
Wow.
So it's kind of like, yes, there are certain things you can manage, but you have to be aware that, there can be unexpected events as well. Mm-hmm. And I think that not knowing sometimes it can cause anxiety, as Greg's mentioned. But I think it's really important to be able to stay calm in those situations and always know that you've got two routes. You try your medication first. If you're not happy, your child's not making any, improvement, then I wouldn't be afraid to call either 111 or 999.
Yeah, I think we should be clear to everybody here. If the medicine's not working, go straight to 999.
Yeah.
Just call an ambulance. I think that's the thing to do.
So, Greg, that leads me on then to a 999 call. So, if a child is taken into hospital, into A&E with asthma, what happens? What's going to happen then? We're assuming then that the medication hasn't worked, so what's going to happen when that child arrives in A&E?
Yeah. So, there's a number of ways you could end up in A&E with asthma, and sometimes it could be simple as you've gone out and you've forgotten your medication and you have an asthma attack, and that's not infrequent. It can be that the medication you have preventers medications in asthma. So most people often have two inhalers, one to prevent medication and one to kind of use in an asthma attack. And sometimes what has been working as a preventer for a long time just isn't effective, and your asthma overtakes you. Depending on the severity of it, really depends on what happens to you when you come to A&E. But you could end up immediately being put onto oxygen. We might give nebulized medications, so it's medications that comes through as a vapor to go straight into the lungs. In some situations, we have to put medications, in through IV access or tablets to help dampen down the immune system. And in the most extreme cases, children end up in intensive care.
Right.
Yeah.
So it can be really serious, can't it?
Absolutely. It's there's an article that's just come out very recently, and there was lots of attention on the BBC just really highlighting the number of asthma deaths there have been over the years. We think in the last 12 years, in the last 10 years, there's been 12,000 asthma deaths and probably 30 or 40 deaths of children amongst those. And it can come out of nowhere, really. So it's often thought of as a mild illness. Most people with asthma don't even really consider they've got an illness, because they manage quite well with it. But for some people, it's it really takes over their lives as well. Yeah.
Can children grow out of asthma? Is it a condition that you can grow out of?
Really.
Okay.
Don't really see, you can kind of grow out of having a wheeze, really. Okay. But really, what can happen with asthma is you can spend long periods of your life, without it impacting you at all, or without needing medication. But it's always potentially lingering there in the background. It really seems to be how it's understood at the moment.
Right. Okay. And Ambreen, you talked about some of the triggers that bring on your daughter's asthma, and one of them was exercise. As she's got older, how has that affected her with school and sports and studies and all those things as a growing girl, navigating her way through her childhood, but also having to carry the fact that she has asthma? How's that affected her?
Okay, so amongst our community, being of South Asian heritage, there's a huge stigma attached to having any sort of medical condition, but specifically with asthma, people tend to think that, oh, well, if that's the trigger, then stop doing it. And actually, I think I took the opposite stance. As an academic, I know that if I increase the exercise for my child and help her over time, she's going to become, fitter, healthier, and it's going to do us some good. So since she was 6, I encouraged martial arts. I encouraged a variety of sports, and thankfully she is really, really active. She's able to do a lot more, but recognises that where she knows she's going to be exerting herself more, she can take her medication earlier to impact her well-being. So I mean, even recently when she started high school, I've had feedback from her teachers, because you kind of go through that transition, going from primary school where you've got other people to rely on in order to manage your condition and help you and recognise the signs, etc., to that independence.
Yes,
to
absolutely.
be able to know what you're looking for, understand your own body, listen to your own body, and be able to, act accordingly.
I was going to ask actually about high schools. Can she take her own inhaler and have it with her?
Yeah.
So that's the difference, isn't it? Because obviously in primary schools, the office or what have you will act as the dispenser, won't they? And they'll have a first aider that will help a child to take their inhaler. That's a massive step when really it's just a summer holiday and then they're back. And has she navigated that okay? Has that been okay for her?
I think for us, it was a huge step. And I think having the allergy nurses involved, having the asthma review beforehand, making sure she was okay taking her inhaler independently, making sure she was trained on her EpiPens as well, really helped to empower her. And I think the great thing about allergy clinics in specific, when they're dealing with children with asthma and with allergies, is the fact that they treat the child. They don't speak to the parent unless there's something that a child can't answer. They treat the child as an individual that's managing their own condition. As a parent, you're kind of secondary and you're in the background to support if needed or prompt if needed. And I think that's been of real benefit to helping empower her to manage her own condition, build that confidence, build that independence, and it's that's helped her remain independent, travel to school independently, by train with her friends. It's no matter what the weather, I can feel confident that she knows what to do in an emergency. She knows how to manage her own condition when she's out, when she's doing sport, when she's, out and active. That I think doing it and encouraging it early where you can really helps. And I think making sure you're also attending your yearly asthma review with your GP or your allergy nurse, or your asthma nurse, depending on who manages you. I think that's so key, and I probably underestimated it myself as an adult, the impact that can have in making sure you're on the right medication and you're managing your condition early.
Yeah, she does sound like an incredible young lady, though, doesn't she? That's somebody that's had everything put in place for her to enable to be independent. So that's fantastic. Now, Greg, I want to know more about the tech side of your work, so the tiny medical apps, and how it's changing the lives of people with asthma for better. So tell us about it.
Sure. So there's an app out there that anyone can download in the UK or Ireland called Digital Health Passport. You can search for it in your app stores. You can download it. It's designed for people 13 years and upwards to have on their phone. So if you're 12 and under, it sits on the parent's phone. That's really just to do with a lot of sort of data rules and GDPR and so forth. We've worked with the NHS, going back to working with the NHS in London about 6-7 years ago as part of a wider programme of work in London to raise the standards of asthma care in London, and it was commissioned across the NHS there and is now in a number of areas where we work with the NHS bodies, but anyone can use the app. The idea is to really bring everything into one place to make managing asthma easier for people and just to make asthma care smarter. So that might be bringing your asthma plan into one place, having alerts for pollen and pollution in your area, being able to track your symptoms. But one of the big bonuses really is being able to access educational content to help you manage your asthma better. And a lot of that is around improving your inhaler technique. And we have a lot of resources from Asthma and Lung UK and other charities on there to really help people do that. So I'd encourage people, if you know someone with asthma, ask them to download the app and see if it helps them.
What we'll do for those listening, and you think, I haven't got a pen, how am I going to write it down? We will put it in the show notes for the podcast so that you'll have that with all the links that you need. Greg, just mention the names of the charities as well that have been involved in supporting that development.
Yeah, so Asthma and Lung UK is the big one. There's a charity called Beat Asthma, comes out of the northeast of England, that works specifically with teenagers. Moving on Asthma, again, fantastic videos created by teenagers for teenagers. There's also information on there from the anaphylaxis campaign for people with severe allergies. And there's a lot of resources, obviously, from the NHS, just kind of pulling it all into one place for people.
It sounds absolutely fantastic. Now, Ambreen, I know that you've had some experience of using the app. Tell me how you found it useful. What have you used the app for?
So I have actually downloaded this app on my phone, and then my daughter has a parental control type phone, so I've also installed it on hers. Some of the features that Greg's mentioned have been really key to us. So, for example, the pollen, the pollen information, knowing that you need to take an antihistamine before you leave the house. Being able to understand, when it's going to be cold, when it's when you're more likely to need an extra layer or other things like that. Being able to, probably the most key thing, when you go for a yearly asthma review, you're often asked how your symptoms have been managed, and you're trying to remember the last 12 months. I don't know about you, but when you get to a certain age, you're like, you barely remember the last month, right?
And so to be precise,
being able to track your worst periods, so when you've had a low peak flow, and being able to monitor that over time, being able to track that on there, being able to track your peak usage, to kind of show how your usage is changing over time, I think has been probably the one most sort of important tool for me, because how else do you record that? For my daughter, probably the most interesting thing that she found was the training videos, both for allergies and for asthma. It's all well and good that there are loads of videos out there, but to have everything on one platform, to be able to go through and access it as you need, and then be able to go back and check in case you're not confident. But then you've got that also on your phone in case you're caught, anywhere and you don't know what to do.
I think that's brilliant. It sounds brilliant. Greg, do you have any indication yet of the usage yet, and how widely it's being used?
Yeah, so at the moment, I mean, there's lots and lots of people who download the app. It's it's over 10,000, but we've got 5,000 or coming on for 5,000 people now who kind of register to kind of use all of the features of the app. So they kind of set themselves up to get the alerts and medication reminders and so forth. But it's still really in its infancy. It's really only been pushed out live from September last year, because there's quite a long process to go through to get something approved within the NHS and all the kind of governance in place, as you'd expect and as you'd want, really, to make sure that it's safe, that the data doesn't get shared with people and all the rest of it. So it's been a while signing off, but the user number's going up quickly. And one of the ways we're finding now is to try to get to people where the NHS isn't quite reaching, is by using TikTok to promote the app, which obviously used a lot by young people, and fantastic responses, really. We started working with some influencers on TikTok, and now we've started kind of creating our own content, but promoting it out there. We get there's a massive demand for this, really, so I think we'll really see the user numbers shoot up quite quickly this year.
Greg, it sounds brilliant. It sounds absolutely brilliant. I'm delighted that you came to talk to us about it. Now, we always get to this point in our podcast where we ask our guests to share with us something that they'd like people to take away. And I'm sure, Greg, both from understanding the condition itself and the symptoms and where you can go for help, and Ambreen, just hearing your daughter's story from you and just how she's developed into an independent person managing her condition and this fantastic app. What would you want, both of you, and I'll ask Greg first, what would you want somebody listening to take away from today's podcast, if you could leave them with a pearl of wisdom?
Yeah. So I think that there's a campaign every year called Ask About Asthma, and it's every September it runs, and there's three main aims that we try to get across to people for those, and there's three things we really want people to do. One is to make sure they've got an asthma action plan. So this is something that the doctors provide. It tells you what to do when your asthma is getting worse. It tells you when kind of 111 is the kind of right thing, and it also, as we kind of touched on earlier, when nothing's working, when to call 999. So you've really got a clear plan of what to do, when to step up your treatments. The second thing is we really want people to understand how to use their inhalers properly. Lots of people have got inhalers, but they've never really been taught to use them properly, or they've kind of forgotten what they were told on the day one, when they were learning. So see the videos from Asthma and Lung UK, or you can see them also on the app, or talk to a pharmacist and make sure that you're really using your inhalers properly. That's really, really important. And then the third thing is you should all be getting an annual review with your doctors. If you're not getting invited in, insist that you do. And if you do get invited, please, arrange a time to come in and make sure that everything is optimised, for your child or for yourself if you've got asthma.
Greg,
So
that's great. How about you, Ambreen? What would you like people to take away from listening to you today?
For me, I've got three main messages, I think. And the first one would be to encourage early independence for any child. I also think encouraging exercise early is a really good thing. A, to increase your lung capacity, B, to just keep people active. And the third thing is definitely to improve education of both yourself, your families, and your child, to get rid of and remove that stigma. We should be talking about asthma. We should all be aware of the symptoms, the treatments, and we need to normalise the conversation about it.
Guys, thank you. It's been absolutely fascinating. In the studio here, I'm leaning closer and closer in to talk to you both. It's brilliant. We could stay on forever. It was brilliant. Guys, you've been listening to both my guests, Greg and Ambreen, talking about asthma. You've been listening to the Family Health Podcast. If you want to subscribe to the Family Health Podcast, do that on your regular listening platform for the podcast, and it means that every week the podcast will just arrive on your device. It's genius. You can also follow Mini First Aid on socials, which means that you will benefit from our regular health and first aid advice. And Mini First Aid have a newsletter, a family health newsletter that comes out every week, giving you advice on various conditions that affect you and your family. And my final request, if you have any subjects that you would like us to talk about on the podcast, please do get in touch. We love to hear from our listeners when they say, I'd love to know about this. And asthma was one of the big asks. So guys, thank you so much for coming today. You have been listening to Family Health by Mini First Aid. Thank you for listening to Family Health by Mini First Aid. I hope you found our podcast really useful and informative. If you want to know more about Mini First Aid classes, courses, qualification courses or first aid supplies, please do visit minifirstaid.co.uk or look us up on all your favourite social platforms at Mini First Aid. I take Savlon Scar Prevention Gel everywhere with me so that I am always prepared for the many little and sometimes bigger accidents that my kids encounter. Thank you again to Savlon Scar Prevention Gel for sponsoring Series 3 of the Family Health Podcast.